Welcome back. This weekend saw the end of the Sisonke vaccine trial. Over 450,000 healthcare workers have been vaccinated as part of the study. Due to many factors, progress during the trial was slower than anticipated. So how does this bode for phase 2 of the national vaccine rollout? Let's discuss this with Professor Linda-Gail Bekker, co-principal investigator of the Sisonke study. She joins us now live via Zoom. Linda, thanks for your time. We appreciate it again. So how are you feeling? I'm sure you must be tired. How did it all go?
I think a mixture of relieved and quite elated, really, Shahin. We're delighted that almost 500,000 healthcare workers now have the added protection of a COVID-19 vaccine, and that's very good indeed.
Yeah. So let's talk about the pace at which this rollout went, right? Because many people argue that phase 1 was particularly concerning because it took so long and we only managed to vaccinate just under 500,000 healthcare workers.
I think it's really important to understand the context under which Sisonke operated. So those doses brought into the country were brought under the auspice of research, which meant that every vaccine center had to be oversighted by a research team. Now, the research teams we called on were those who ran the Ensemble J&J phase 3, and there were just 31 of them. So really, we could not go to scale the way we would really want to go to scale under normal conditions. And, you know, I think given that, I think we did extraordinarily well. We managed to get to almost our 500,000 goal. We expect to do that next week in the Eastern Cape, and that would just close, you know, that chapter, which I think is such an important one. That means all the doses that were allocated for this program have in fact been used up. And, you know, I think we've made a huge dent in protecting the healthcare workers in the country. Now, I think in phase 2, the country intends to have far more vaccine centers open. And therefore, I think, you know, we'll see the rollout moving to scale. I think we should, you know, give the national rollout a chance and see how that does.
You know, day one of this national vaccine rollout hasn't gone without hiccups, because we have reporters across the country and there's been some delays. Some provinces have actually said that they haven't officially started phase 2 of the rollout. Given what you've learned through phase 1, what does it mean and what lessons can we actually get from what you endured?
Well, it was a very steep learning curve for us. I must say we had certainly never undertaken a project that would enroll 500,000 people before, so that was extraordinary. And I must say, on the ground, the vaccine centers we engaged with were exemplary. You know, they took to the project very well and got on with it. So I'm really hopeful that that augurs very well for the other vaccine centers. I think we learned a lot that an electronic data registration system does need a little bit of hand-holding for individuals to just get to terms with it to make it work. I think we also learned that the demand perhaps was something more than we anticipated. So queue control and crowd control was another steep learning curve for us. I think also some of the other aspects we learned was the handling of the vaccine on the ground is of course absolutely key and critical. And again, you know, I'm hopeful that all of that is going to go really well on the ground. I'm sure that the initial starting somewhat slowly, perhaps a few teething difficulties in the beginning are to be expected. We certainly had those in the beginning, but very quickly the teams got into the groove and got on with it. And, you know, at the last days, we were managing up to 22,000 vaccines a day. And that, again, you know, just in 40 sites. I know we're going to have many more of those sites, so I'm hoping it'll be better.
Yeah. Very quickly, Linda-Gail, let's talk about the way in which people were called to get vaccinated. This system, this EVDS system, of course, now on a much larger scale, we're going to see scores of people daily. In terms of the vaccination sites and how people are brought in to be vaccinated, can there be any improvements there?
Yes, I think, I think what we didn't take full advantage of, and I believe that sort of EVDS phase 2 will do, is scheduling. And I think this is going to be important. So individuals will not only get notification of their registration, but they'll actually be told where they need to go and what their appointment date is. And I think that that is really very important. I think we've seen that working well in countries to the north of us, in America and so on. And I think, the fact that our system also has that app, as it were, I think is very important, because it means that you can manage crowds. It means that, which is very important, obviously, for COVID protection. And it does mean it's far less frustrating for the vaccinees themselves if they know they have a date and a time.
All right. Thank you so much for your time. We appreciate it. That was Professor Linda-Gail Bekker, co-principal investigator of the Sisonke study.